not being here, so I appreciate those that. A round of applause. So, I'm Terry Robinson, the president of the Vernon Community Network. Okay, so without further ado, Ms. Jenna.
I'm Jenna. I'm a 21-year-old college student. I'm in my senior year by credits, but I actually won't be graduating until next fall. I plan to pursue my PhD in clinical psych after graduating, so still kind of waiting to see where I'll end up with that. But I'm currently a psych major. I just switched from physiology and neurobiology after my internship this summer. But the main thing that I'm here today to talk to you about is my own personal mental health journey. And why I want to do this is both to spread awareness of what it's actually like to live with mental illness, and also I wanted to share some insights with you all into how the community can better support their citizens struggling with mental health. So I went to public school my whole life. In high school, I started going to Suffield Academy, a private high school up in Suffield, Connecticut. I mainly went there because I knew that I was a good swimmer and I could use that to get into college. They had one of the best swim teams in the country at the time. So kind of transitioning from public school to private school was a big jolt for me. Any transition periods are a little bit tough, but just sort of the requirements and like what the day-to-day life looks like. I would be in Suffield, Connecticut from 8 a.m. to 8 p.m. every day. So it was just a little bit different than your traditional high school experience. It was also a boarding school, so it was 60% boarding, 40% day. And the majority of the people that lived as far as I did out, 40 plus minutes, they would be boarding students. So I did have a bit of trouble making friends because of that kind of gap between boarding and day students. And so during high school is sort of when my depression symptoms picked up. Those symptoms kind of included overall low mood, fatigue, loss of interest in things like swimming, going out doing things with friends. I started isolating in my room a lot, not really talking to my family when I would come home from school. And I also started self-harming during this time. I was taking large amounts of Tylenol, and this kind of became a repetitive self-harm behavior. And so my senior year of high school, I was finally seen by a professional after talking to my parents about my symptoms. And I was diagnosed with depression and anxiety at this point. I knew there was kind of more going on, but wasn't really sure what or how to describe it. So at this point, I was like, yes, like this sounds like kind of what I'm going through. So I was put on Prozac at this point and kind of like waited to see how that would work. Unfortunately, when I started taking Prozac, I started getting really intense nighttime depressive episodes, and it was almost like even worse than before. And so at the end of high school, this was right after graduation, I had a friend group breakdown where I sort of had people talk really bad about me behind my back to all of my other friends in the school. And I started getting, text message after text message like, oh, why are these people saying this about you? Like, they said they were never your friends, like, they don't like you, like, what's happening? And, like, already not being in a good place, kind of feeling off balance from my medication, it just threw me into a very deep depressive place. In the same week, my ex-boyfriend actually had a suicide attempt. And I was also sexually assaulted during the same week. And so immediately in the aftermath of that, I had my first suicide attempt. And what happened was I took a large amount of Tylenol. I told myself I was going to go to bed, and the reason that I got to that point was some people say like they do it to escape the pain. For me, it was more like I thought at that point that everybody would be better off without me there. And so that is what kind of finally pushed me over the edge. And after my attempt, I was taken to Manchester Memorial Hospital. I was 17 at the time, so I was put into the adolescent inpatient psychiatric ward. I actually had to wait 5 days in the emergency room to wait for an inpatient bed to open up. And that was almost like an additional trauma on top of already the attempt. The staff in the emergency room was not the most friendly or warm. You really weren't given a lot of attention other than when you had visitors come. If they got too close to you, the staff would tell them to back off because they were making the other patients uncomfortable. So that was definitely a difficult experience, one right after the other. When I finally did get into the inpatient, it was a little bit better. I was in the adolescent part, so I didn't have to deal with some of the more serious mental illness that you do see in the adult wards, because that kind of develops more in your 20s. I really, while I was in the inpatient, I was put on a new medication that actually worked a lot better for me. But I was still feeling like I didn't really have all the answers. After inpatient, I went right into their outpatient program through Manchester Memorial. That was actually fantastic. That was the first time that I had actually gotten what I would say is almost like a therapeutic breakthrough. They utilize dialectical behavioral therapy there. And so what that is the idea that you can have two opposing thoughts. So for example, your friend is going to college far away and it's their dream school. So you can be very excited for them that they're going to their dream school, but also sad that they're going to be so far away from you. And both of those things exist and are true. And so this was the first time that therapy actually made sense to me, the mindfulness, the grounding, identifying the wise mind with your emotional mind. And so after that experience in outpatient, I went off to my freshman year of college out in California. I finally started to make some true friends there, which I hadn't ever had in high school. That was a really big thing for me. It felt like I finally had people who would really connect with me on an emotional level. Whereas in high school, a lot of the time I was told I was too much or like too feeling. But what I did start seeing when I got to college was an increase in my impulsive behaviors, my kind of anxious anxiety symptoms, lack of attention, and also mood swings. And so during my freshman year, I was actually hospitalized with alcohol poisoning. And that was kind of on the end of a long list of impulsive behaviors that eventually my therapist at the time was like, hey, I think we should get you assessed for ADHD. So I did, and I was diagnosed with combined ADHD. And that diagnosis for me made a lot of sense and was very validating. For people with ADHD, I think a lot of people don't know that in addition to impacting your executive functioning skills, it also, especially for women, has a real impact on your mood. Something that occurs with ADHD is something called rejection-sensitive dysphoria. And that's something where if someone that you care about even criticizes you or you perceive rejection, you feel intense emotional hurt. And this is one of the symptoms that people with ADHD say they struggle with the most in their day-to-day life. So after that, I felt very validated with the diagnosis, but I still knew that wasn't really the full picture of what I was going through. So then in my sophomore year of college, I was in a toxic relationship at the time. I was struggling with self-harm again, and I also saw like an increase in my depressive symptoms, as well as my impulsivity, and that wasn't being helped by my ADHD medication at the time. During that time, I also tore my meniscus in my knee and ended up having to have knee surgery. And so, as a lot of people can attest, having physical health problems did not help my mental health at all. And then at that point was when COVID happened. And so while I was out in school at California at the time, they ended up sending us all home. So I ended up finishing up my spring semester of my sophomore year in Connecticut. Based on my experience taking online classes during that time, I decided that I was not going to be successful online. So I made the decision to take a gap year during that time and stay at home closer to my family. After about a semester into the gap year, my grandma actually passed away from lung cancer, which was really difficult for my whole family. That kind of like emotion got me closer with my mom and my family again, and kind of made me realize the value of being close to your family in difficult times. So this is when I made the decision to transfer to UCONN to continue my undergrad closer to home with my family as supports. It also just so happened that my old college decided to split up their science department at this time, so I was not going to have any research opportunities. So it did work out better for me academically, actually, to end up at UCONN. And so during this time, I also finally got out of my very toxic relationship and into my better one. So yes, this was actually the first relationship that was healthy for me. Someone that actually listened to my boundaries and wanted to help me get mentally better. So despite this, I fell out of care with my therapist and my psychiatrist during this time. At this point, I had maybe been to 6+ different therapists, 3+ different psychiatrists, and I ended up actually cutting things off with my therapist at the time because I was describing to her how I experienced negative emotions a lot more than positive emotions, and part of the reason was because I have a lot more of a somatic experience with negative emotions. And she looked at me and she said, "I think you're just overthinking it. Have you ever just tried being?" And I was like, you know, like, I am doing that and I'm still experiencing this, so I ended up cutting off that relationship with her. And so when I started at UCONN last year, I wasn't really in the best place. Despite that, I kind of pushed through. I did end up isolating a lot during that year. Didn't really make those connections at the new school that I wanted to. But what I did end up doing was securing my summer internship. So what that was I worked with UCONN Health. It was a program called the Health Research Program. So I was a student intern for UCONN Health, but I was placed at Community Renewal Team. I worked on their medication-assisted treatment team. So part of what I did was I was trained in peer recovery coaching. I took on a role as almost a mini case manager. I helped some of our clients get into care, like inpatient programs. We had some people just transfer, referrals. I had a lot of fun with that. It was really just like a special feeling to know that you're helping someone and actually see that help manifest and happen instead of, I think a lot of times something that can happen is almost like, you know, you refer someone to some place and then that next organization doesn't follow up, which can be upsetting. But what I did see a lot of this summer was a lot of working together in the community around the area here, which was something that I thought was really cool and I wanted to get more involved in. Hence also why I'm here. Another part of that was I'm actually conducting a research project right now. So what my research project is it is looking at the differences between individuals who have low, medium, and high psychiatric symptom severity who are in the medication-assisted treatment program. And it's looking at the treatment outcomes, so specifically the urinalysis results and the self-reports. So what I'm going to be doing is looking at the between-group differences to see if people with more severe psychiatric symptoms are also seeing poor treatment outcomes. And the goal of that is to kind of advocate for joint mental health and substance abuse care at the same time, which I think is very important. But so after my internship over the summer, my best friend had a suicide attempt, and that kind of took me right back to my own attempt because I realized I hadn't made the growth and the changes that I needed to. I knew that if I didn't reach out and get help, that I was going to end up on the same path and end up back in inpatient. And it was a really big step for me to actually make that call instead of ending up back in inpatient. So what I did was I reached right back out to where I'd done IOP before in the past. I reached out to ECHN. I actually ended up not doing their IOP program because they're joint mental health and substance abuse treatment, and so they require that everybody who does their program has to cut all, even if it's prescription stimulant medication or you have a medical marijuana card, all of that had to be cut down to 0. And that wasn't going to work for me. I was there specifically for my mental health. I really didn't want to have that other use changed or monitored in that way. And so I found myself at Notchog Hospital. They actually have a young adult IOP program, so it's specifically for college-age students. I also thought that was very important because this is a very difficult age in your mental health where, some of those severe symptoms are still developing, and sometimes putting together kids from 18 all the way to like 60 plus can be very difficult because you have people from all different walks of life. They're in different stages of getting mental health care. They're in different stages of figuring out their own mental health journey. I think there's a lot of value in having those small young adult groups with people in that college age group. Because in a way, like, they still are growing up and they still are almost like adolescents and children in a way, versus, people who are in their later 20s, 30s, 40s. So that was something that I really liked about that option. I'm actually doing that IOP program now. And something else that I also got out of that was I started working with a new psychiatrist in West Hartford. And he and I both came to the conclusion that, he did more than I did, but I was diagnosed with borderline personality disorder. And I actually, when I was planning this speech, I wasn't sure if I was going to include this part because of the stigma against personality disorders. Most recently in the news, we've seen Amber Heard was publicly outed as, having borderline personality disorder. And there was a lot of kind of backlash to that and a lot of stigma and assumptions that came out that just in general society has about people with personality disorders. So I just wanted to take a moment. This is a book called I Hate You, Don't Leave Me. It's written by Gerald K. Kreisman. He's a doctor. He worked with a lot of patients with borderline, and he ended up writing this book about it. So I'm going to read you the 8 diagnostic criteria. There's actually 9 now, but this book only has 8. Because I think some people don't know what borderline personality disorder actually is. So the 8 diagnostic criteria are: 1, having unstable and intense interpersonal relationships; 2, impulsiveness and potentially self-damaging behaviors such as substance abuse, sex, shoplifting, reckless driving, and binge eating. Number 3 is severe mood shifts. 4 is frequent and inappropriate displays of anger. 5 is recurrent suicidal threats or gestures or self-mutilating behaviors. 6 is a lack of a clear sense of identity. 7 is chronic feelings of emptiness or boredom. And 8 is frantic efforts to avoid real or imagined abandonment. So one of the things that I want to talk about is number 6 there. The lack of an identity or that lack of an attachment to your sense of self. So part of how I experienced that and how I actually, like thinking back, I've experienced this my entire life, is something called depersonalization. That's when you feel disattached from who you are. And for me, the earliest that manifested was when I was a kid. I used to look in the mirror, and if I looked too long, it would almost seem like, if you can imagine, like I was in a chair sitting on my brain, and it was like the chair tipped back, and I fell back, and I was falling. And all these questions would come up, like, who am I? What am I? How am I in my body? How is this my body? Like, how did I get here? What am I? And it was just this feeling that I wasn't myself, and like my body wasn't my body, and I wasn't looking at myself in the mirror. And I still experience that, but that was something that I actually thought that everyone experienced, and it wasn't until 2 years ago when I was talking with some friends and I brought that up, and I was like, yeah, like, do you ever, like, that scene from Get Out is what it feels like when he sinks down into the chair and is falling into darkness. I was like, do you ever look in the mirror and like that happens? And people were like, no, I can't say that does. So I was like, okay, that is not a normal everyday thing. But it also goes to show, like, when we don't talk about these topics, people can go their entire lives without realizing that something they're experiencing is actually a symptom of a mental health disorder and not just, you know, a normal everyday little feeling. And so another part of disassociation is something called derealization. And as opposed to depersonalization is more being disattached from your sense of self, derealization is more the feeling that the entire world around you is not real. And so for me, that happens with like feeling like I'm in a dream. Sometimes when I drive places, I can't remember the drive and I'll just end up places. It's almost like leapfrogging and lily padding. That's something that they refer to in BPD. It's kind of like jumping from one moment to the next without a clear kind of organized linear line of what's happening. And so all of these are symptoms of borderline that I experience every day. And all of these I thought were normal until I was actually given a word and a name for the feeling. And so that's part of why I think it's very important to get people who they themselves have been diagnosed with these disorders and are willing to share their story, because I think, especially for personality disorders, it's very discouraging, even when you're diagnosed, like, to embrace that as part of your mental health journey because of the stigma against it. Even like considering applying to grad schools, I'm really unsure of if I want to disclose that to people that I'm going to be working with. So this is all things to keep in mind. But yeah, so where I'm at now is I'm doing well. I really enjoy the IOP program that I'm currently a part of. Next steps for me are going to be finding an individual therapist to work with. At this point, I know that I need to be with someone who's very experienced hopefully in ADHD or borderline personality disorder, and I definitely want to explore a therapy called EMDR. That's eye movement desensitization reprocessing, and that is something that helps people process past traumatic events and move forward. So I'm really excited to be back in care and back working on myself, because I think it can be really easy to fall into, when you're out of care, just thinking like, oh, like I'm getting by, like it's fine, like it sucks, but like I'm doing it. But when those kind of crisis moments happen, like my friend having her attempt, that's when, if you're not doing well, you really know it. And it's really important to kind of take those preventative measures so you're not putting yourself into crisis every time events like that happen. So yeah, that's kind of my mental health journey. Just getting a little bit more into the research side of things. I now actually am volunteering as a peer recovery coach at the UCONN Recovery House. UCONN has a great recovery community. They actually have the most students who have ever been enrolled in their program enrolled. And it's also really cool because the Recovery House focuses not only on recovery from substance use, but also from different mental health things. So for example, there are people there that identify as being in recovery for codependence and things like that. So it's really cool kind of getting a group together of open-minded people willing to talk about what they're going through. And I think in general, more programs like that for young people are going to be very important. In general, I think in our community, something that we should push for is allowing people with mental health histories to have sort of a space like this to talk and to share their stories. I'm one person who is successful despite my mental health, but what about people you know that are struggling and they weren't able to go to college because of their mental health symptoms? What about people who ended up homeless because of their mental health symptoms? Types of people like that don't always have platforms to share their story and share what they've gone through. And I think it's really important to hear those voices, as well as voices like my own. And so just in closing, like, I think mental health in general needs to be educated about more widely and regularly. I would love to see some kind of mental health education added into the public school programming. I know the Jordan Porco Foundation was actually working on something like that with the Connecticut Public Schools. But I know in general, certain people think that you can't teach children concepts about mental health and good mental health care. And people of every age experience emotions. And if we aren't teaching, even at the basic level, emotional regulation, then how are we going to expect these children to grow up into emotionally regulated adults? I think it's very important that we start as young as possible educating about what mental health disorders are, what symptoms to look for in yourself and your friends, because I think it's also very easy to kind of dismiss someone when you see them struggling, especially like in high school. You're like, oh, like whatever. But I think it is very important to pay attention to those signs. And that's why it's so important to start that education early, because if you don't, you're allowing that stigma to grow in people over time.